Hey, future dental hygienists! Welcome to NBDHE Study Hub, where we're making board prep a little less overwhelming and a lot more doable. Today, we're testing your knowledge of anatomic sciences with 24 board-style practice questions. Here's how it works. I'll read the question and all 4 answer choices. You'll have a few seconds to choose your answer, and then I'll give you the correct answer and explain why. And don't just listen. Actually pick an answer before I reveal it. Keep track of your score because when we're finished, I want you to comment how many you got right out of 24. All right, future hygienist, let's see what you know. Here comes question number 1. Question 1. Which cranial nerve provides the primary motor innervation to the muscles of mastication? A. Facial nerve, cranial nerve 7. B. Trigeminal nerve, cranial nerve 5. C. Glossopharyngeal nerve, cranial nerve 9. Or D. Hypoglossal nerve, cranial nerve 12. Take a few seconds and lock in your answer. The correct answer is B. The trigeminal nerve, cranial nerve 5. More specifically, the mandibular division, V3, supplies motor fibers to the muscles of mastication, including the masseter, temporalis, and medial and lateral pterygoids. If you got that one right, you're starting off strong. Let's go to question 2. Question 2. A patient cannot close the left eye tightly and has weakness of the muscles of facial expression on the left side. Which cranial nerve is most likely affected? A. Trigeminal nerve, cranial nerve 5. B. Facial nerve, cranial nerve 7. C. Accessory nerve, cranial nerve 11. Or D. Hypoglossal nerve, cranial nerve 12. What's your answer? The correct answer is B. The facial nerve, cranial nerve 7. The facial nerve innervates the muscles of facial expression, including the orbicularis oculi, which is responsible for closing the eyelids. Damage to this nerve can cause facial weakness and difficulty closing the eye. 2 down. Let's keep moving. Question 3. Which bone forms the anterior portion of the hard palate? A. Palatine bone. B. Maxilla. C. Sphenoid bone. Or D. Vomer. Lock it in. The answer is B. Maxilla. The palatine processes of the maxillae form approximately the anterior 3/4 of the hard palate. The horizontal plates of the palatine bones form the posterior portion. An easy way to remember this for boards, most of the hard palate is maxilla. Question 4. The mandibular condyle articulates with which bone to form the temporomandibular joint? A. Maxilla. B. Temporal bone. C. Zygomatic bone. Or D. Sphenoid bone. What do you think? The correct answer is B. Temporal bone. The head of the mandibular condyle articulates with the mandibular fossa and articular eminence of the temporal bone to form the TMJ. If you've spent enough time staring at skull diagrams, hopefully that one was an easy point. Question 5. Which muscle is primarily responsible for protruding the mandible? A. Temporalis. B. Lateral pterygoid. C. Masseter. Or D. Posterior belly of the digastric. Think about it. The answer is B. Lateral pterygoid. When both lateral pterygoid muscles contract, they protrude the mandible. The lateral pterygoid also assists with opening the jaw and side-to-side mandibular movements. That's 5 questions down. How's your score looking? Question 6. Which salivary gland is located anterior and inferior to the ear and is traversed by the facial nerve? A. Sublingual gland. B. Submandibular gland. C. Parotid gland. Or D. Minor palatal gland. Lock in your answer. The correct answer is C. Parotid gland. The parotid gland is located in the preauricular region, and the facial nerve passes through the gland before dividing into its major terminal branches. Remember that relationship, facial nerve and parotid gland. Question 7. Which duct carries saliva from the parotid gland into the oral cavity? A. Wharton's duct. B. Stenson's duct. C. Nasolacrimal duct. Or D. Sublingual duct. The answer is B. Stenson's duct. Stenson's duct carries saliva from the parotid gland and opens into the oral vestibule opposite the maxillary second molar. That's a location I would definitely remember for boards. Question 8. Sensation from the lower teeth is primarily carried by which nerve? A. Infraorbital nerve. B. Inferior alveolar nerve. C. Greater palatine nerve. Or D. Lingual nerve. What's your answer? The correct answer is B. Inferior alveolar nerve. The inferior alveolar nerve is a branch of V3. It enters the mandibular foramen and provides sensory innervation to the mandibular teeth before continuing as the mental nerve. If you've practiced local anesthesia, hopefully you grabbed that point. Question 9. Which structure passes through the mandibular foramen? A. Mental nerve. B. Inferior alveolar nerve and vessels. C. Facial artery. Or D. Lingual artery. The answer is B. The inferior alveolar nerve and vessels. The inferior alveolar neurovascular bundle enters the mandibular foramen and travels through the mandibular canal, supplying the mandibular teeth and supporting tissues. Question 10. Which muscle elevates the mandible and is especially powerful during forceful biting? A. Masseter. B. Lateral pterygoid. C. Mylohyoid. Or D. Platysma. Lock it in. The correct answer is A. Masseter. The masseter is one of the major muscles of mastication and is a powerful elevator of the mandible. Think masseter equals powerful jaw closure. And that's 10 questions down. If you're 10 for 10 right now, okay, future RDH, I see you. Question 11. Which cranial nerve carries taste sensation from the anterior 2/3 of the tongue? A. Facial nerve, cranial nerve 7. B. Trigeminal nerve, cranial nerve 5. C. Glossopharyngeal nerve, cranial nerve 9. Or D. Vagus nerve, cranial nerve 10. Careful with this one. The correct answer is A. Facial nerve, cranial nerve 7. Taste from the anterior 2/3 of the tongue is carried by the chorda tympani branch of the facial nerve. But here's an important board distinction. Taste is facial nerve. General sensation from that same region is mainly carried by the lingual nerve. And speaking of that, here's question 12. Question 12. General sensory innervation from the anterior 2/3 of the tongue is provided mainly by which nerve? A. Chorda tympani. B. Lingual nerve. C. Glossopharyngeal nerve, or D. Hypoglossal nerve? The answer is B. Lingual nerve. The lingual nerve carries general sensations such as touch, pain, and temperature from the anterior two-thirds of the tongue. So remember this pair. Taste, facial nerve through the chorda tympani. General sensation, lingual nerve. If you can remember that distinction, you've got two very testable concepts down. All right, quick study break. You're officially halfway through. How are you doing? If these questions are helping you prepare for boards, take a second to like this video and subscribe to NBDHE Study Hub. It really helps support the channel and allows me to keep making free NBDHE practice questions and study content just like this. And while you're there, comment below and tell me which NBDHE subject gives you the most trouble. Okay, back to boards. Question 13. Question 13. Which papillae are the largest lingual papillae and are arranged in a V-shaped row anterior to the sulcus terminalis? A. Filiform papillae. B. Fungiform papillae. C. Circumvallate papillae. Or D. Foliate papillae? The correct answer is C. Circumvallate papillae. Circumvallate papillae are large papillae arranged in a characteristic V-shaped row just anterior to the sulcus terminalis. They also contain numerous taste buds along their lateral walls. Question 14. Which structure separates the oral cavity from the nasal cavity? A. Soft palate only. B. Hard and soft palates. C. Tongue. Or D. Mandible? The answer is B. The hard and soft palates. The palate forms the roof of the mouth and separates the oral and nasal cavities. The hard palate forms the anterior bony portion, while the soft palate forms the mobile posterior portion. Question 15. Which bone contains the foramen rotundum? A. Ethmoid bone. B. Temporal bone. C. Sphenoid bone. Or D. Occipital bone? The correct answer is C. Sphenoid bone. The foramen rotundum is located in the sphenoid bone and transmits the maxillary division of the trigeminal nerve, V2. Remember that because we're about to test it again. Question 16. The maxillary division of the trigeminal nerve exits the cranial cavity through which opening? A. Foramen ovale. B. Foramen rotundum. C. Jugular foramen. Or D. Stylomastoid foramen? The answer is B. Foramen rotundum. V2, the maxillary division of the trigeminal nerve, passes through the foramen rotundum. Meanwhile, V3 passes through the foramen ovale. Here's your quick memory check. V2, rotundum. V3, ovale. Keep those paired together. Question 17. Which artery is the major arterial supply to the face and gives rise to branches around the lips and nose? A. Facial artery. B. Basilar artery. C. Vertebral artery. Or D. Posterior auricular artery? The correct answer is A. Facial artery. The facial artery is a major branch of the external carotid artery. It courses across the face and gives off branches that supply the lips, nose, and surrounding facial tissues. Question 18. The internal carotid artery primarily supplies which region? A. Scalp and superficial face. B. Brain and orbital structures. C. Tongue and floor of the mouth. Or D. Teeth and gingiva only. The answer is B. Brain and orbital structures. The internal carotid artery enters the cranial cavity and provides a major source of blood to the brain. Its ophthalmic branch also contributes to the blood supply of the orbit. 6 questions left. Stay with me. Question 19. Which lymph nodes commonly receive lymphatic drainage from the lower lip, mandibular incisors, and tip of the tongue? A. Submental nodes. B. Parotid nodes. C. Occipital nodes. Or D. Retropharyngeal nodes. The correct answer is A. Submental nodes. The submental lymph nodes commonly drain the central lower lip, mandibular anterior region, and tip of the tongue before lymph continues toward deeper cervical chains. Question 20. Which lymph nodes commonly receive drainage from much of the cheek, lateral lower lip, maxillary teeth, and mandibular posterior teeth? A. Submandibular nodes. B. Occipital nodes. C. Mastoid nodes. Or D. Preauricular nodes. The answer is A. Submandibular nodes. The submandibular lymph nodes drain many structures of the oral cavity and face, including much of the cheek, lateral lips, and numerous maxillary and mandibular dental regions. 20 down. Only 4 questions left. Finish strong. Question 21. Which muscle forms the muscular floor of the mouth and supports the tongue? A. Mylohyoid. B. Buccinator. C. Temporalis. Or D. Stylohyoid. The correct answer is A. Mylohyoid. The paired mylohyoid muscles form most of the muscular floor of the oral cavity. They support the tongue and can elevate the floor of the mouth during swallowing. Question 22. Which muscle compresses the cheek against the teeth and helps keep food on the occlusal surfaces during chewing? A. Buccinator. B. Masseter. C. Genioglossus. Or D. Sternocleidomastoid. The answer is A. Buccinator. The buccinator forms the muscular wall of the cheek and compresses the cheek against the teeth. That helps keep food positioned between the occlusal surfaces while you're chewing. Basically, it's keeping your lunch where it's supposed to be. 3 points if you laughed. Just kidding. Please don't add 3 points to your score. Question 23. Which cranial nerve supplies motor innervation to most intrinsic and extrinsic muscles of the tongue? A. Facial nerve, cranial nerve 7. B. Glossopharyngeal nerve, cranial nerve 9. C. Vagus nerve, cranial nerve 10. Or D. Hypoglossal nerve, cranial nerve 12. The correct answer is D. Hypoglossal nerve, cranial nerve 12. The hypoglossal nerve supplies motor innervation to nearly all of the intrinsic and extrinsic muscles of the tongue. The major exception is the paladoglossus, which receives its motor supply through the vagus nerve via the pharyngeal plexus. All right, 1 question left. Let's finish this. Question 24. Which structure is located in the midline of the mandible, on the lingual surface near the roots of the mandibular incisors, and serves as an attachment area for tongue and floor of mouth muscles? A. Genial tubercles. B. Coronoid process. C. Mylohyoid ridge. Or D. Mental foramen. This is your final answer of the video. What are you choosing? The correct answer is A. Genial tubercles. The genial tubercles, also called the mental spines, are small bony projections on the lingual midline of the mandible. They provide attachment for the genioglossus and geniohyoid muscles. And that's number 24. You made it! You just completed 24 Anatomic Sciences NBDHE practice questions. So now I need to know, how did you do? Drop your score in the comments. How many did you get right out of 24? And if you missed a few, don't just memorize the correct letter. Go back, look at the explanation, and make sure you understand why the answer is correct. That's how these practice questions actually start helping you on boards. If this video helped you study, make sure you like the video, subscribe to NBDHE Study Hub, and turn on notifications so you don't miss the next practice set. We're going to keep working our way through the major NBDHE subjects together, one question at a time. You've got this. And until next time, keep calm, keep scaling, and keep studying, future RDH. I'll see you in the next one.